So for those who may not be familiar with who I am, my name is Marcus Rather. I am a financial advisor through Cetera Investors. And my practice has expanded outside of just the Richmond area, now down to Charlotte, North Carolina. So I'm now affiliated with two different offices, but fully licensed in many different states, working with clients throughout their lives and making sure that they're accomplishing their financial goals. Again, you may be asking, what is finance and Medicare? What do they have entail? But naturally, healthcare has a cost and an expense in retirement. It's actually the second largest expense in retirement is healthcare. And with that being said, that's more reason why I want to be sure that we give you the tools, the perspective to have of how to navigate affording healthcare in retirement. So all my contact information is here. And of course, the disclosure slide that you will need is on the next. That's just for compliance. So don't worry if you don't fully understand any of the information there. But at this point, I'm going to pass things off to my trusted resource, my trusted colleague, Ms. Jennifer. Hopefully she's still there. I think we just had a technical difficulty. But Jennifer was going to be guiding us in that conversation for what we need to know about Medicare, some changes that have occurred for 2025 and other different parts of Medicare.
I had to I had to log off for a second. I thought it was the presentation or it was Zoom. It must have been on my computer, but the timing was not good. Anyway, I have my presentation up and I'm gonna move over to that. Can everyone see where it says Medicare Scholar? Okay, good. Okay, so we're just going to talk about Medicare today. And if you have questions, Marcus, I know you'll be able to see them because I probably won't be able to see them. But feel free to jump in and ask a question because this is strictly educational. So if you can walk away from this and feel like you learned a lot more about Medicare than what you started the webinar with, that's the goal. We're going to cover as much as we can that is informational, nothing plan specific, no carrier information or anything like that. But hopefully you will be able to understand Medicare when we're done with this. Let's see. Hold on. Watch my computer freeze here for a second. Let me see. Give me 1 second. Okay, here we go. All right. Broker information. Basically, I'm an insurance broker with GHT Insurance Services. I work specifically with Medicare. So GHT is an insurance agency. The agents that I work with, the brokers, they work in different aspects of insurance. The aspect of insurance that I work in for the last, I guess it's been 11 years now, is Medicare insurance. So that's what I do, information about me. We're going to talk about who's eligible for Medicare, your coverage options, when you can enroll, the next steps, and of course, questions are at the end. But like I said, feel free to jump in anytime to ask questions. First thing is who's eligible for Medicare. So you must be a U.S. citizen or legal resident for at least 5 consecutive years and one of the following: age 65 and older, under 65 with a qualifying disability, any person who has been diagnosed with end-stage renal disease or ALS, Lou Gehrig's disease. That's all qualifying factors for Medicare. Coverage options. So this is where it can get kind of confusing because what you're looking at is parts. So when you talk about Medicare, you'll hear parts and you'll hear plans, right? And they have letters behind them. So basically, the parts to Medicare, these are the important ones that you're going to be looking at and thinking about. And I think there will be a handout that's either been provided or will be provided that sort of sums this up. And this will go along with that. So you have Part A, Part B, Part C, Part D, and then Med Sup or Medicare Supplement. In the world of Medicare, a Medicare supplement and a Medigap mean the same thing. So if you know someone who's on Medicare and they say I have a Medigap, it means they have a Medicare supplement. Original Medicare, which is what you are thinking of when you go on to ssa.gov to sign up for Medicare, or if you're taking your Social Security prior to age 65 and you get this red, white, and blue card in the mail. is Part A and Part B. So that's the original Medicare. Part A is hospital insurance, so inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. The cost of Medicare when it comes to Part A, you've been paying into Medicare since your first job that you were paying Medicare taxes. You were paying into Medicare, and that allows you to have a premium-free Part A. And if you did not meet the requirement for the 40 quarters in order to get a premium-free Part A, you can qualify through a spouse's work history. Some people will pay for Part A. It's not super common. Most people you meet have Part A and it is premium free to them. This deductible of $1,676 in 2025, we find that number out in the fall. The same time we find out what the Part B premium is going to be, the Part B deductible. We also find out what the Part A deductible is. So this year, that's $1,676. Stays of more than 60 days have daily copays. You can utilize any hospital that accepts Medicare, and hospital coverage outside of the US usually is not covered. Part B, this is when you are really thinking about, do I want to enroll in Medicare? It usually tends to be, do I want to have Part B? Because you are going to pay for this, right? This is your medical. So Part B is physician services, outpatient hospital services, ambulance rides, outpatient mental health, lab services, durable medical equipment, wheelchairs, oxygen, CPAP machines, diabetic testing supplies, things like that will fall under durable medical equipment, outpatient physical, occupational, and speech language therapy, and then some preventative care. So the way Part B is structured, if you're thinking about what does Part B pay for, how do I work with Part B, if that is the only thing that you have, if you don't have any additional insurance and you just have the red, white, and blue card with A and B on it. Medicare Part B is structured 80-20 coinsurance. So that means that 80%, if it's approved by Medicare when it comes to Part B, so this would be like a doctor's visit. If it's approved, Medicare is going to pay 80%. You're responsible for the other 20%, subject to the annual deductible this year of $257. So that number also changes each year. We find that out in the fall. And if you were to start Medicare, let's say January 1st, and you go to the doctor because you're sick, you're going to owe the first $257. After that, if Medicare approves the visit, they're going to pay 80%. You're responsible for 20%. The reason why you want to pay attention to that is because where it says no out-of-pocket maximum, Medicare does not have a ceiling on what that 20% number could go up to. So if you visited the doctor one time, in 2025, you'd pay the $257 copay or deductible. And then let's say you went again, and now you're at the 20%. If you didn't have any other insurance, you'd be responsible for 20% of those medical bills that were approved by Medicare. But if you had a series of visits and they all fell under Part B, say it was a weekly visit to the doctor or weekly infusions, chemotherapy, or dialysis, something like that, that 20% could add up. And there is no maximum as set by Medicare as to where you're done spending. So that's the part to pay attention to, is that on original Medicare, if it's covered by Part B, you're responsible for 20% after the deductible, and there is no out-of-pocket maximum on that. The monthly premium was one of the questions that we asked before the presentation, and the standard premium for this year is $185, and it may be adjusted based on your income. It may be higher if you sign up after your initial enrollment period. So there's going to be another handout that talks about costs, and you may have already seen this somewhere. There's a chart that is updated every fall. We call it IRMA, Income Related Monthly Adjustment Amount. And basically, higher income earners will pay more for their Part B. So they're going to look back 2 years from your prior 2 years tax returns. So in 2025, we're looking at 2023, and they're looking at your modified adjusted gross income. And then That's how they're determining what you're going to pay for your Part B. Now, let's say you retire in 2025, but they're looking at 2023's numbers and you're not working anymore in 2025. And now all of a sudden you got this bill for Medicare Part B at 185. Oh, and now also an adjustment because they see that you're a higher income earner. If something's changed, like let's say you had retirement work, work stoppage, you went from full-time to part-time work reduction, divorce, marriage, different things can affect it, but you can appeal IRMA. There's a form that you can fill out and you can appeal it. So think of the base rate as $185. And then if there is an IRMA adjustment that you are billed for, there is potential if something's changed in your life to appeal that to get your premium to the standard amount. Coverage.
With sharing that, oh, I'm sorry, not to cut you off, but with sharing that, I think that leads to reflecting on one of our poll questions, but also prompting another, right? So previous poll question was the standard premium for Part B. But I thought this would be a good time to just throw in another poll question that we had for Part B, which was, what things can determine your premium, right? So if you're looking at the screen, if you're able to give a response, I know she provided the answer, so hopefully everyone gets this right. But when you sign up for Medicare Part B, your standard premium is determined by your age and or your health. If you can just go ahead and see if you answered that correctly on this pop quiz. And while we do pause for that, there was a question that was asked. Jennifer, I'll leave it to you to, if you feel that this is a good time to answer it. But one of the questions that was asked is the 20% co-insurance, the 20% co-insurance that's required to be paid by the person, can that be covered with a supplemental coverage? I don't know if you want to answer that now or if that'll be answered later, but that is a question that was asked from our group.
Yes, the answer is yes. And we'll go over Medicare supplements a few slides down, but that 20% is something that you could have covered for you by a Medicare supplement. So yes.
Awesome. So thank you for providing that. It sounds like we'll be going through some more details. For those looking at the screen, if you still have that poll, the answer is false. The answer is false. So when you sign up for Medicare Part B, your standard premium is not determined by your age and or your health. And I think I heard this from a client of mine. We were having a conversation and he realized that possibly, his mother is in retirement and he's looking forward to retiring himself as a baby boomer. And it was I think, an interesting realization that the premiums that his mother paid are possibly the same premiums that he would pay, assuming that there, are no income adjustments. So there are no extra premium costs based on your age or your health for Medicare Part B, but there is a income adjustment for your premiums for Medicare Part B. So thank you for that pause. Jennifer, I'm gonna let you continue on the road that you were going. So thank you.
Okay. Yeah, no, that's perfect. I have heard that before. Some people think that your Medicare Part B premium is affected by age or health, and it's not. And yes, someone who's 90 years old, if they're, a standard income earner. Now, that could be when talking about it being adjusted for being a higher income earner. That's a possibility. There's also potential adjustments if someone is on a lower income side where they may qualify for Medicaid. That could take things down. So it just depends on the situation. Most people you meet are going to be at the standard rate of $185 this year. And where it talks about your premium, where it may be higher if you sign up after your initial enrollment period, that's connected to penalties. And there's a lot of misconceptions when it comes to penalties and people thinking that you're required to sign up for Medicare as soon as you turn 65 or you're going to pay some kind of a penalty. It really depends on your situation and the insurance that you have, maybe through your employer or, if you don't have insurance. If you don't have insurance and you're eligible for Medicare, and you decide not to sign up for it, you are looking at a penalty if you delay. But if you're covered by your employer and you have what's considered creditable insurance, you won't be dealing with penalties when it comes to that. I see a hand raised.
Yeah, just one more thing to add to that. So again, it sounds like income is a big thing that determines your premiums for Part B. Are you able to explain, or I guess I just want to parenthetically note, the hold harmless provision is something else that could play a role too, right? So you mentioned, high income that could increase your premium. You said Medicaid could potentially decrease the standard premium. But the increases in the premiums every year, there are also some hold harmless provisions that were passed in some bills that were passed in the past. I know that's a lot of past words I just used. But the hold harmless provision, I believe, also protects someone from their premium increasing in Medicare if it were more than the dollars that they would receive in Social Security. Is that also true from a Medicare standpoint?
I'm not positive on that because I'm not 100%. I can't speak to it as far as, your increase in Social Security and the increases as far as Medicare goes. You may be right on
Mhm.
that. That's something that I would love to know the answer to. That one I'm not familiar with as far as
All
them
right, I'll see if
increasing
I can get
your.
some information.
Yeah, get some information on it because when you look at the IRMA chart, I know what the maximum could be. But talking about, how it could
Mhm.
affect you as far as what your Social Security would be, that's interesting. And I would love to see, what the rule is on that, as far as that goes. But I'm not sure. I
Yeah,
have
well, my
not had
understanding
to
from the
deal with
reading
that.
is typically they protect your premiums from increasing by a certain amount if the dollars, because our cost of living adjustments are awarded to Social Security, but then you also typically have Medicare premium increases. I think it's
Right.
like a dollar for dollar uh, match, right? So if the dollars in your Social Security benefit increase more than the dollar increase in your premium, you still may have that. But if the dollars in your Medicare premium increase more than the dollar increase in your Social Security, I think there's like a hold harmless provision. But yeah, that's something I can do some research on for you
Yeah, definitely,
or
because
for
that
us.
is interesting. I haven't seen it affected. I know, I mean, I talk to people who will tell me all the time, yeah, we got the cost of living increase, but then we also got our Medicare increase because since I've been looking at this, day in and day out for the last 11 years, I've seen Part B go down one time, and that was because they overestimated the cost of an Alzheimer's medication that they were anticipating coming on the market and would cost a lot more to Medicare. And so it did not end up panning out the way they expected it to. And so the only time I saw a decrease from year to year on Part B, I want to say it was 22 to 23 maybe. But it had gone up a little bit too much and then they brought it back down. And that's the only time I've seen it go down. I mean, expect Medicare Part B to go up every year because that's typically what it does. So coverage, you can go anywhere in the country if you have original Medicare, Part A, Part B, anywhere that a physician who accepts Medicare. Do you accept Medicare? Not, do you take my insurance? Do you accept Medicare? If they accept Medicare, you can go there. And then some preventative health care is provided. Hold on, it's delayed here. Moving slides. Let's see. Uh, yep. All right. A, B, there we go. So what's not covered by original Medicare Part A and B? So Part A and B deductibles, the co-insurance, the premiums, that's pretty expected. Those things are not going to be covered by your Part B. Part B excess charges, that may be where a doctor will see you, but they don't accept the Medicare assignment. They're allowed to bill a percentage over what Medicare would allow them to. And so that's not going to be covered by Medicare. That's something that either you would pay out of pocket or you may have a Medicare supplement to help you pay for that. And then outpatient prescription drugs, and then additional benefits such as hearing, vision, and most dental. And then long-term or custodial care. Those are not covered by Medicare A and B. So A and B, we said A was hospital, we said B was medical, and now we're going to talk about D, prescription drugs. So Part D, just think D like drugs. Part D. These help with the cost of prescription drugs. So you think about getting a prescription from your doctor, whether they're going to call it in or fax it in, you're going to pick it up or they're going to deliver it to your house. These plans help with the cost of prescription drugs, and they are only offered through private insurance companies. This says you must continue to pay your Part B premiums, but I will say you could have A and not B and still be able to enroll in a drug plan. So I don't, that this particular presentation saying you must continue to pay your Part B premiums. I have seen people who have A. You can have A or B. Most people have both when they sign up for D, but it's not necessary to have both in order to sign up for a drug plan. Where you might see someone who could have A, not B, and then needed D is if they were 65, they signed up for their Medicare Part A because they were eligible for it. They did not have a premium. They were not contributing to an HSA because if you are contributing to an HSA, you have to stop when you're going to enroll in Medicare. So an HSA was not a factor in enrolling in Part A. And then they got a letter from the carrier of their employer's insurance, and it said that if you are a Medicare beneficiary, this plan does not include creditable prescription drug coverage. So it has to meet requirements set by Medicare in order to be considered creditable. So in this case, this particular, and I'm thinking about a certain person off the top of my head who had A, they had employer coverage, and then they also signed up for a drug plan. That way they had creditable prescription drug coverage. See a
Hey,
hand?
just wanted to ask our participants. I know it was a little choppy coming through my reception. Do you mind possibly repeating some of that? I think I might have missed some of the information that you just shared.
Okay.
Um,
What was the last part that you think you heard?
I couldn't even tell you. It just got very choppy.
Okay. So it's Part D is prescription drug coverage, right? Only offered through private insurance companies. You must continue to pay Part B premiums. I'm going to say a correction to that statement is A or B. An example that I was giving that may have been choppy was I had someone who signed up for Part A, had coverage through their employer that was not an HSA plan, and that is why they could sign up for A, stay on their medical plan through the employer. They got a letter from the carrier of the employer's insurance, and it said for any employee on this plan who is eligible for Medicare, this does not include creditable prescription drug coverage. If you're going to remain on this plan, you need to enroll in a Medicare Part D plan. And so they did. So they had A, which is hospital, didn't have to pay for that because they had premium free due to work history. They had medical coverage through the employer, but they also signed up for a Part D plan. So even though it says B, it could be A or B. And these are for medications that you receive from a retail or mail order pharmacy. So think about picking up at the pharmacy or mail order. Some carriers have their own mail order. You may be dealing with that now from your employer's insurance. There's several different ways that you can get medications. If you're thinking of things like a Canadian pharmacy, that does not count. That's not part of a Part D plan as far as that goes, and that's not considered creditable drug coverage. The coverage, okay, cost enrollment and coverage. Coverage varies from plan to plan. Catastrophic coverage protects you from high drug costs. The benefits can change from year to year. They can and they do. So this is something to pay attention to because during the annual enrollment period, which you'll see a slide on that towards the end when we talk about enrollment periods, you have the opportunity to look at what plans are available for we'll say now 2025. We're going to see in October what's available for 2026. This is when you want to review your current prescriptions to see if they've changed and see how your plan has adjusted. You get a notice in the mail. It's called the annual notice of change. Tells you, it could be tiers. It could be the medications that you're on and the tiers may have changed. It could be the premiums have changed. But typically, you will see some type of an adjustment from year to year with these plans. So the benefits can change from year to year, and you just want to pay attention to that. Usually coming in the mail the end of September, beginning of October. October 1st is when all of the following year's prescription drug plans and Medicare Advantage plans get published so that everyone can see what's available. And you can begin to make changes, which we'll talk about, towards the end in October 15th. Enrollment coverage is not automatic and penalties may apply if you enroll late. Thing to think about that is I've met people before who enrolled in Medicare and weren't taking any medications and felt like they were able to have just their Medicare A and B, possibly a Medigap, a supplement, and because they weren't taking prescriptions, didn't need a drug plan. So Medicare doesn't make you enroll in a Part D plan, but they will penalize you if you were eligible for Medicare and you did not have creditable prescription drug coverage. You could have it through your employer, but if you only have A and B and you don't have any other insurance, then when you do go to apply for a Part D plan, there would be a penalty. And they assess the penalty for every month you didn't have it from the time you were eligible for it, and the penalty doesn't go away. So that's why it says penalties may apply if you enroll late. Each plan has a list of drugs that it covers called the formulary. The list of drugs can change throughout the year. It can change. I don't see it happen a lot where people had a drug covered and then it changed. I mean, occasionally you may see something like that, but it's the formulary. If you're taking a lot of medications, it's something to pay attention to because you could have a plan that covered a drug and then maybe it moved off the formulary or they may have adjusted it. So it's just something to keep an eye on. So all formularies have assigned the medications that it covers. They have assigned each medication a tier. So the lower the tier, the lower the out-of-pocket costs. If you're looking at a tier 1, those are your generics. Sometimes you can even get those at no cost. Sometimes, like I've gone to a pharmacy before and they had a flyer on the counter and it basically listed off some medications that even if you didn't have insurance, you could get this list of medications at no cost to you. As the tiers go up, the cost to you is typically going to go up. Tier 5s, that's going to most of the time be your most expensive medications that are available, but it just depends. You always want to look at it because every plan can assign a different tier to a medicine. They get to choose how the tiers are assigned. So you may be on a plan where your medicine is a tier 3, and then next year you look again at maybe another plan and you see your same medicine might be a tier 2, and that affects your copay because typically your copays are higher as the tiers get higher. So coverage stages. This year, coverage stages, we have the annual deductible, but not all plans have a deductible. But that would be the first stage is the deductible. And I see your hand. No, not you. Okay. Initial coverage. So that's up to
I
2,000.
want to say it is me, but get through it. And I know we have a question that's going to be asked, and then we also have 2 quiz questions to ask. So just wanted to go ahead and preempt that.
Okay, perfect. Initial coverage up to $2,000. So what that means is that in 2025, your potential doesn't mean everyone's going to spend this, but your maximum out of pocket is $2,000 for the year. You could spend much less than that. It depends on what you're taking. If you're taking something very expensive, if it's covered by the plan and you're running it through the plan, once you hit that $2,000, you're done spending until the end of the year. It starts over again on January 1st. But once you reach catastrophic, which is hitting that $2,000, then you have no costs picking up your medications through the end of the plan year, which is December 31st.
So for that, even I have some questions on that. But
Okay.
before I ask those questions, I do want to share one of our poll questions that we prepared pertaining to Medicare Part D. So for all our participants, there should be a question that pops up on the screen. And this question, hopefully you heard the answer. Just in case you didn't, we will provide that answer for you. But the question is asking, in 2025, there is no longer what is called a donut hole coverage stage for Part D drug prescription. Do you believe that's true, or do you believe that is false? Again, the question, as you're seeing it, reading it, there is no longer a donut hole coverage stage for Part D drug prescription. We're just going to allow a few more seconds on that. Jennifer, there was a question that was asked in our chat. I believe you did answer this, so hopefully it's not too confusing, as I'm asking a lot of different questions from different directions. So
Okay.
one of the questions was, do you have to have Part D? That's part one of the question. Do you have to have Part D? Is it required?
So it's not required. You do not have to have it.
Okay.
Okay. But if you choose not to have Part D and you choose to have it down the road, say when you're 65, you say, I don't want to have a Part D. I don't need it. I'm not taking anything. But you change your mind when you're 75 or you're 80. Medicare is going to want to see what kind of insurance you had to cover prescription drugs from the time you were 65. If you did not have creditable drug coverage through your employer or VA coverage for prescriptions, CHAMP VA, TRICARE for Life, federal benefits that include drug coverage, those are considered creditable. If you just chose not to have any type of drug coverage and you decide later you want it, that's where you're going to have a penalty that doesn't go away.
Okay, so that
But
seems very
no, it's not
particular. Thank you.
required.
Right. So thank you for answering that the way you did. Sounds like it's very, I don't say straightforward, but no, you don't have to have it. But if you find that you need it later and you did not have it, it sounds like there would be an extra cost. Now, speaking of extra cost, that was a part two of the question is, how do, it says apps. I'm not sure if it's apps or if these happen to be medications, but it says, how do these apps such as RX and Single Care affect the cost of Part D, if it does at all? So the things like Single Care, do those affect the cost of the Part D premium?
I'm trying to think about what those would be. Are they similar like a Good RX or like Cost Plus drugs, things like that, that you can run the medicine through those?
I'm assuming that's what the question is asking. Yes. Thank you for the
Okay.
response. Yes. Yes.
Okay, so if you're running your medicine through GoodRx, or if you go to the pharmacy counter and you've got your Part D and you've got your GoodRx, it's your choice as to whether or not you want to run it through your drug plan or through GoodRx. GoodRx is not going to bring down the cost of what your copay would be running it through your plan. One thing to remember is that if you take the medicines that you are prescribed and instead of running them through your Part D plan, you run them through GoodRx or you get them through Cost Plus drugs or wherever, it's not counting towards your spending. So when we say that $2,000 is the max, that is spending on your plan. That's money where they're looking at, well, they picked up this, they picked up this, they picked up this, and they're looking at it. If you're taking medicines and you're running them through GoodRx, it doesn't matter when it comes to that calculation. They want to see if when they're calculating it, when you hit catastrophic, and remember, catastrophic doesn't affect most people. You have to be taking a lot of medications, or you have to be taking really expensive medications, or a combination of just a few inexpensive ones, you're probably not going to be anywhere near it. But say you combine, I worked on one today where it was 5 medications. 4 of them were super inexpensive generics. But what threw the whole thing off and made the numbers, go a little crazy, where he had to really consider what drug plan he was looking at, was the expensive blood thinner. One expensive blood thinner can add up, and it can add up as far as your copays go. Now, if you took that blood thinner and you said, I'm not going to pick that up through this plan, I'm going to run it through GoodRx. That's your choice. You can do that. Nobody's telling you that you're required to do something at the pharmacy cash register. It's just not going to count toward your spending to get you into catastrophic. Whereas if, say, you were taking that expensive blood thinner and you filled it January, February, March, April, maybe April you were somewhere near or around catastrophic. If you were taking that same January, February, March, April, and you were running it through a good RX, you're not near catastrophic. You're not running it through the plan. So it's kind of you have to pick either or. But if I've met people before who want to use GoodRx or want to use a manufacturer assistance program when they're picking up expensive meds, and they don't want to run it through a Part D. They don't want to have a Part D. That's your choice. You can decide you don't want to have a Part D, but if at some point in time in your life you have to get a Part D to help you because the medicines have gotten out of control, you don't get as much help as you anticipated, the penalty is going to be there, and the penalty doesn't go away. So,
so it was broke up a little bit on my audio. Hopefully everybody was able to hear that, but this is summarize some things that I've heard. One, using those resources, they don't impact the premium for Part D. That's one. Now, two, it sounds like if you choose to exercise those options to fill your prescriptions, the cost through those, if you don't run it through Part D, they will not reach your max out of pocket, which it seems like is $2,000 for Part D. And thus, you will not also reach the catastrophic coverage as well, right? So, am I correct in that summary that one is your choice,
correct.
Two, it doesn't impact the premium, but it does impact the out of pocket? And then I think third part of that question was how much does Part D usually cost? I think you answered that on the previous slide, but can you just remind us how much does Part D usually cost? I think it depends on, is it based on income or is it based on your zip code and area?
So your zip code and area are going to determine what plans are available. They're county based, essentially. Choosing your plan is really going to be dictated by what medicines you're taking. Someone who's not taking any medications can look for the least expensive plan that's available. An easy way to look at that, Medicare.gov, type in Find Health and Drug Plans, type in your zip code, look Medicare Part D. You can see what's available in your county. They're listed in order by least expensive to most expensive. If you want to get more specific, you plug in your medications and you look at your medications that way. You can choose a very inexpensive drug plan. You can choose a more expensive drug plan. If you're choosing a drug plan based on what you're taking and you are taking expensive medications, you may be on the higher end of the range of what's available in your county as far as costs go. And the costs do vary. I can't really get into the specifics on it because that's a premium type question when it comes to something offered by a private insurance company. But that information is on Medicare.gov. And you go in, it's very easy. You don't have to have an account set up. Just type in Medicare.gov, put in your Find Health and Drug Plans, your zip code, type in, Medicare, Part D, however they have it listed, and it'll show you all the plans available in your county. And you can see the range. It'll start with the cheapest and it'll go to the most expensive. And really choosing it is based on what you're taking. Now, the thing about that to kind of remember is when you're choosing a plan, you're choosing it based on what you're taking at that time, okay? And maybe your medications change throughout the year. Maybe your doctor prescribes you something. You get on a plan say you got on a plan for January 1st of 2025. Switched it during the annual enrollment period because of what you were taking. And then out of nowhere, your doctor prescribed you something that's expensive. And they prescribed it to you in May. Well, unfortunately, unless there's some type of a special enrollment period, like you moved out of the area and you are in a new county where your plan wasn't offered, you're kind of going to have to work with the plan and your doctor on having that medication and running it through your plan through the end of the year. But then when the annual enrollment period comes up, you're going to want that list. And that's this is something that, if you're working with someone specific, this is what they're helping you do. This is what I do all day, every day, is you take the medications, you look at them, and you compare them to the plans that are available. And so it's unfortunate that you can't switch during the year, but you always have the fall to reevaluate. You're not locked in. You could be taking nothing right now, get prescribed 3 meds this year, and say, hey, I can't do this for next year. I need something else. And that's when we're going to see. We're all going to find out October 1st what's available in 2026. And you can see based on your medications in your county what's available.
So I know we're, working with time. I'm not sure if I want to ask this question. I think you did kind of answer it, but last question before we keep the train moving. Does the $2,000 out-of-pocket maximum for prescription drugs for the higher tier 4 and tier 5 drugs? So again, there's a $2,000 out-of-pocket maximum for prescription drug Part D. Does it apply for higher tier 4 and tier 5?
It applies for all of them. It applies for all of them. It applies
Okay.
for every medication you run through the plan. They are looking and you'll get an explanation of benefits and it shows how much you've spent this year, how much the plan has spent this year, and it'll typically tell you how close you are to becoming, getting to the catastrophic level. Some people are never near it, but if you're getting close to it, your explanation of benefits will tell you.
And then for our pop quiz, the answer to that is actually true. There is no longer a donut hole for Part D. And I think is that also clarified by the maximum out of pocket? So is there no longer a donut hole there for Part D?
So there is no longer a donut hole. That was an open, what do we call that? An open book test question, because on this slide you now see the coverage stages. So if you're looking at this, donut hole used to be in between initial and catastrophic. And if you know anyone who was on Medicare prior to January 1st of this year, and they were taking medicine on the costlier side, they may have told you, oh, my medicine went up, I went into the donut hole. And it's kind of confusing if you're not on Medicare to understand what the donut hole is and what it meant to you. But if you were on Medicare and you were taking expensive meds, you became familiar with the donut hole because you did pay more during the donut hole. It was also called the coverage gap. But so the big change this
So
year,
with that,
and that leads into
yeah,
this
let's say
one.
with that, there's a new question there. So now that there is no donut hole for Part D prescription drug, we want you to know what law that was passed that provided that relief. So this law was passed in 2022. It allowed Medicare to negotiate drug prices and set a new cap on out-of-pocket spending for Medicare beneficiaries. Do you know the name of that bill? Again, that bill was passed in 2022. It was I'll say progressive in a sense that it progressed the amount of max out-of-pocket, because I think 2024, that amount was different than what it is this year. I think 2024 was what, 3,000, 3,500? And to this point, it was a bill that progressed to where 2025, the max out of pocket is 2,000. So we got a few answers. Please, just want to allow maybe another 5 seconds for everybody to submit their answer. It's actually kind of 50-50 split between two. So was it the Inflation Reduction Act, the Medicare Protection Act? Was it the Save Retirees from Excess Spending bill, or This Isn't Real? Surprisingly enough, no one said this isn't real. So I'm kind of happy to see that that's not selected. But the correct answer was the Inflation Reduction Act. Yes, the Inflation Reduction Act that was passed in 2022. Of many different things that it impacted, one of the things were Medicare Part D prescription drugs, which is something now that sets a max out of pocket for what people will be spending on their drugs. So congratulations to those who got that answer correct. And thank you for participating for those that did not get that answer correct. I'm going to pass it back off to you, Jennifer, to continue on.
All right, perfect. Yeah, I'm impressed that they know about the Inflation Reduction Act. And also, if you're curious about it, you can Google it and see how it proposed these changes. And the biggest one was the one from this last annual enrollment period, where we saw every plan had to offer a deductible no higher than $590. It could be lower, it could be not there. And then initial coverage limit being $2,000 is the biggest factor affecting people who were spending more than that on their covered medications, taking away the donut hole so that you were not experiencing a jump in your costs, once you reach that number. So it went initial coverage and, figuring out your initial coverage spending was a little bit of you and the plan, but now it's pretty straightforward. It's $2,000. Some of the credits may be part of the plan, but you're not going to spend more than $2,000 on covered prescription medications. And then the word covered is a big factor in this because that's like when we talked about, should I run a medicine through GoodRx? Well, that's not covered. It's not being run through the plan. So you want to make sure, as much of your medication as you can gets run through your plan because that's what's counting towards these stages. You could have a $2,000 drug that you pick up in January. And if you pick, and I have had several people in that situation where when they saw what they had to pay, it was initially right off the bat $2,000, but they weren't paying anything else for the rest of the year. A little side note to that, if $2,000 sounds like a crazy amount to drop at the pharmacy on, in January, they also allow the Medicare payment plan. So you can set your plan up to take that $2,000 and divide it out through the rest of the year. And all plans are required to offer that to you now. All right, so moving on from Part D, so we saw A, we saw B, we saw D. Now, the choice that you have, okay, when it comes to enrolling in Medicare, is taking your A, your B, your D, rolling it under the umbrella of a Part C plan, which is Medicare Advantage. So if someone says they have a Part C, that's your Medicare Advantage, okay? And this is going to be a heavily marketed Medicare option. This is where your phone's ringing off the hook. This is the stuff in the mail. This is all for Medicare Advantage because these are combining your Medicare Part A, Part B, may also include prescription drug coverage. So the plans don't have to offer prescription drug coverage. There are some people who don't want Part D because, like I said before, they may have had drug coverage through TRICARE for life. Federal employees that have federal benefits, they have excellent drug coverage. Those are considered creditable by Medicare, and they want that to be their primary drug coverage. So, for the most part, the people who don't have that kind of coverage, they're getting an Advantage plan that includes A, B, and D. These are also offered by private insurance companies, and they often include additional benefits above and beyond original Medicare, and it does vary by the plan. So we talked about in the fall, October 1st, we're going to see what's available to everyone on Medicare. We said prescription drug plans, and this is the other one. It's the Medicare Advantage plans. You must be enrolled in Medicare Part A and B, and that's a requirement. You have to be in A and B in order to get onto an Advantage plan. You must live in the plan's service area. It's county-based. You must be able to make an informed decision. The plan premiums and benefits can change from year to year, very similar to a prescription drug plan. They can vary and they can make adjustments. You must continue to pay your Part B premium. If you are not having your Part B premium deducted from your Social Security distribution and you are paying them directly, if you somehow do not pay your premium and it lapses, your Part B lapses, they will immediately take you off the Advantage plan because you have to have an active Part B. Many plans include prescription drug coverage. Coverage can be limited to a service area unless it's an emergency. You may be required to use a network of doctors and hospitals. That depends on the plan. That's very plan specific. And they may include additional benefits above original Medicare. Again, that varies by the plan. The benefits and the extras, those things are all plan specific. So when it comes to the types of plans, this is similar to insurance that you may have seen while you were working, or even what's available if you have marketplace insurance and you don't have coverage through your employer. You're looking at HMOs. Think about HMOs and PPOs. So health maintenance organization point of service plans, PPOs, special needs plans, private fee for service where it says other plans. I can't think of really anybody anymore that I know of who are on any of these other ones, the private fee for service, Medicare savings accounts, Medicare cost plan. HMOs and PPOs, they're pretty straightforward. HMO is a network. It's network based. So if you want to see a doctor, you want to make sure that doctor is in the network before you visit with them. A PPO allows you to kind of go in and out of network. A special needs plan, those are typically plans you have to qualify for. So when you think about that, think about Medicare and Medicaid. If you know someone who's eligible for both, then there would be typically a special needs plan that's available to them. Some plans have options based on health condition. So it's a qualifying event, qualifying factor, I should say, for those types of plans. Now, going back, the alternative, right? So when you're eligible for Medicare, you sign up for your A and your B. You do that through SSA.gov, or they're going to mail you that card directly. You may delay your B based on your work. You may have signed up for A, delay your B, but when you're ready and you have both, you can choose a Medicare Advantage plan, or you can choose to stay on original Medicare and purchase a Medicare supplement or a Medigap, and that will basically cover the gaps in original Medicare. So a gap that we talked about was that 80/20 coinsurance with that 20% having no cap on it. That's a gap. So the supplements are called plans. You have plans that have letters. And you're talking, all these letters that are here. These are sold by private insurance companies. Massachusetts, Minnesota, and Wisconsin have different standardized plans, and benefits can vary by plan and by when your Medicare coverage began. So there's a booklet that you can get. It's called, it's offered, it's a CMS booklet. You can pull up the PDF on your computer, but it's available on Medicare.gov. It'll show you, Medicare.gov has all the answers to these questions. If you want to see the chart for a Medicare supplement, and it'll tell you Medicare pays this, the supplement pays this. Now, talking about when your Medicare coverage began, because some of these went away. So some of these are still available, but some of these went away. Like I know F, if you were not 65 prior to January 1st of 2020, you're no longer able to get an F. But if you were 65 prior to January 1st of 2020, there's the potential for you to still look at that. So with a Medicare supplement, you must be enrolled in A and B, a resident of the state in which you're applying for coverage. Typically think of this as 65 or older, but in certain states they allow you if you're under 65, and sometimes depending on the state, they have limitations on which one you can get. But for the most part, when you're thinking about Medicare supplements, you're thinking about people who are on Medicare who are over 65. So they help helps with some of the out-of-pocket costs that are not paid by original Medicare. If you look at that chart, the Medicare supplement chart or Medigap chart, it'll tell you, here's what they pay. Here's, what Medicare would pay and what you would owe. But that's what they're going to help you pay for. These are the premiums for a Medicare supplement that you pay every month are going to be affected by your age, your sex, your tobacco status, your zip code, the plan, and the carrier. So it just depends. Those factors all weigh in basically on determining what you're going to pay every month to be on the Medicare supplement. But generally, the best time to enroll is during the 6-month open enrollment period following your 65th birthday month or your Part B effective date. If that is later, that would be later because maybe you're continuing to work and you have coverage that you don't want to give up yet. And so you delayed your Part B. And then there may be other situations which would allow your acceptance to be guaranteed. So your plan choices, and this will be on the sheet that is emailed out so that you can see it at the bottom. Basically, when you're ready for Medicare, you're enrolling in A and B. You're deciding, I'm going to get A. I know I'm going to be paying for B, but that's what I'm going to get. And then I'm deciding whether or not I want to get a Medicare supplement and a drug plan. That means you're staying on the federal program, or you want to choose an Advantage plan, getting a Part C. So A and B plus D, maybe some additional benefits, all covered by a private insurance company. The fundamental difference between these two options, this, talking about this plus this or this, is one is your benefits being administered by the federal program. So when you go to the doctor, you're giving them, if you're on original Medicare, the red, white, and blue card. You're giving them your supplement card. You can go to any doctor that accepts Medicare. We talked that that was one of the things about original Medicare. The supplement is not a determining factor when it comes to coverage. If Medicare covers it, Medicare is going to process the claim. The supplement processes their portion. If your deductible still applies, the supplement's not going to pay that. But generally, if Medicare says yes, supplement pays. If Medicare says no, Medicare denies it, you're not getting it. So the supplement's not going to pay anything. And then the alternative is the Advantage plan, and that's getting your Medicare benefits from that private insurance company. So when you go to the doctor or you go to the hospital or you go to the pharmacy, you're giving them the one card. You're putting away the red, white, and blue card, putting it somewhere safe at your house, because if you were to give them that card at the doctor's office and you were on an Advantage plan and they try to run that claim through Medicare, they're going to deny it because your medical benefits are being handled by that private insurance company. When can I enroll? So your initial enrollment period is that 7-month window around your 65th birthday, the 3 months before, the month of, and the 3 months after. Now, if you're going to turn 65 in, say, April, and you go online and you sign up for Medicare in January, the earliest your effective date is going to be April 1st of the year you're turning 65. So sign up, we'll say April is the month that you turn 65. You can sign up in January, you can sign up in February, you can sign up in March, but your card is going to say April 1st is your effective date because it's going to be the first of the month that you turn 65. If you wait till the months after, they'll do it the very next month. They'll make it effective the very next month. If you work past the age of 65, you can enroll in A and B. It is recommended that you speak with your benefits administrator and that you keep records of your health insurance coverage. You always have the potential for Medicare to come back and say, hey, how were you covered? We need to know or see that you had insurance. It's not common that they're doing it because there's an employer verification form that you're going to submit if you are outside of that initial window for enrollment. You're going to submit a form that HR signs off on, and it says, this person has worked for us, had insurance. It could be your spouse's insurance, but they're going to sign off on it, and you're going to submit that when you go to enroll. But occasionally, they could come back. I have seen this happen before, where they want to see, hey, did you have insurance during this period to this period? They just want to verify it first. So that's why it says keep records of your health insurance. Enrollment after the age of 65. When retiring, you may be eligible for a special enrollment period that will allow you to enroll in original Medicare for up to 8 months after the loss of employment or employer coverage, whichever happens first, and enroll in a Medicare Advantage or prescription drug plan for up to 2 full months after the loss of employer health benefits. So if you decide to retire when you're 70 years old, you now have what we call an SEP that allows you to enroll in Medicare and allows you to get onto the plans that you need because you are leaving your employer coverage. So, don't think about, well, I didn't do it when I was 65. Well, as long as you were covered by your employer and they had creditable coverage, you will be fine. You will not have a penalty. If you work for a company, however, with fewer than 20 employees, your new to Medicare enrollment window is the same as anyone else turning 65, the 3 months before, the month of, and the 3 months after. And that's because if you work for a company with fewer than 20 employees, even if you want to stay there, and even if you want to stay on their insurance, you still need to enroll in Medicare A and B because Medicare is primary. So larger employer, more than 20 employees, that's where you kind of have the decision. You can decide not to. You can delay Medicare if you want to, but if it's under 20, like the company I work for, I think we have 17 employees. So if someone turns 65, they need to enroll in Medicare because Medicare is going to be primary to our group's insurance. Medicare supplement open enrollment. So your eligibility is the first month. This period lasts for 6 months, begins on the first day of the month in which you're both 65 or older and enrolled in Medicare Part B. So It's showing that the month you turn 65, you have that 6 month window to get onto a supplement. And the open enrollment basically means that you will be able to pick a supplement and enroll in it. You will not have to answer any kind of health underwriting questions. And this also applies if you delay Part B and say you're covered by your employer's insurance. You didn't sign up for your Medicare Part B because you were covered by their insurance. It was considered creditable. It was a large employer. Maybe you waited till you were 70 or 71. Now your Part B is starting. That's your 6 month window. The effective date of your Part B is the beginning of the 6 month window. Additional election periods. So the biggest one, the one that you will see everywhere, is the annual enrollment period. That's October 15th to December 7th. Remember, I said that all the plans that are going to be available for the following year are published on October 1st. That does not apply to Medicare supplements because if you look through that Medigap guide, those supplements, as far as benefits and things, those don't change from year to year. This is for Medicare Advantage plans become available, or should say they're published to see what's available for the following year, and then also the prescription drug plans. Now, during the annual enrollment period, you can decide to enroll in a Medicare Advantage plan if you had been on original Medicare with a supplement and you want to change your mind and move to Advantage plan. You can go back to original Medicare. You can switch drug plans, switch Advantage plans. There's several different ways you can make changes during this time period, and this is all for coverage that begins on January 1st. So whatever you did or did not do on December 7th, once the 8th rolls around, on the 1st of January starts either the plan you changed to or the plan that you were on. Maybe they had their little premium adjustments or, coverage changes. And because you didn't make a change, you're now going to be on that plan with whatever the changes are. The open enrollment period, this is for typically Medicare Advantage. This is relatively new. This started a few years ago. Now, January 1st to March 31st, you can change from one Medicare Advantage plan to another or go back to original Medicare with or without Part D coverage. The thing to think about with this is considered a correction period. This means that you were on an Advantage plan and maybe it was not the right choice. Maybe you were on an Advantage plan the year prior and the annual enrollment period went by. You didn't make any changes. And then in January, you went to the doctor, realized something changed about your plan that doesn't work for you this year, and you can make a one-time change. So consider this a correction. Whereas annual enrollment period, you could find a plan on October 15th for the following year, enroll in it. And then November 1st, your neighbor comes along and says, oh, you should look at this, check this out. And you say, hey, I think I like that better. Boom, you can enroll in it. Whatever your last application is on December 7th, that's what you're going to be on starting January 1st. But now with the open enrollment period, it allows for that one-time change on an Advantage plan, which is very nice because it used to be that whatever you enrolled in as of December 7th, you were going to be on that for the entire calendar year that was following. And then special enrollment periods, think about moving into a new area, a discontinuation of your current plan, if you begin receiving skilled nursing care, or if you move into becoming a low-income Medicaid recipient. So your next steps. When you're thinking about Medicare, you want to review your enrollment periods, whether it's the initial enrollment period, whether your next enrollment period might be the annual enrollment period. You want to see what those are and what you may need to change. If you want to change your supplement, if you're on a Medigap or a Medicare supplement, and we're coming up on June, and next week's June, and you see your premium and you say, I think I want to move to a different Medigap. I'm on one right now, and I think I want to shop and get another one. Typically, you can, if you're not moving, if nothing really is happening other than you wanting to shop, you can do that. Most of the time, depending on your situation, but most of the time, if you want to switch supplements as of right now in Virginia, you would have to go through underwriting to do that. So it's not the annual enrollment period that's going to affect your supplement. Supplements, they can raise their rates in the summertime. Some of them will do it in the spring. But you always have the option to shop it. You just kind of have to keep in mind that, underwriting may be a factor when it comes to switching. So research your options. Think about the enrollment periods, research your options, talk to people, talk to someone you trust, Ask questions, seek help. If you answer the phone and it's a telemarketer for Medicare, they're going to try to sell you something that they're working with. They want to enroll you in something. And that's what a lot of Medicare call centers do. It's a big issue because sometimes people get switched and they don't even realize it. So you need to be very careful when it comes to telemarketing or getting an ad in the mail that, you're like, does that apply to me? Should I do that? Sometimes they're advertising insanely generous benefits that you have to qualify for, right? But they're not telling you that in the big writing. That might be in little fine print at the bottom. And when you call in to the number on the ad, they say, okay, they might ask you a question or two, find out whether or not you're actually eligible for that. And then they say, well, we can't do that, but I can give you this. Be careful about that kind of stuff. Be careful about calling in for something like that. You just want to make sure, you're talking to someone that you can trust, that will answer your questions honestly, because you want to be able to make an informed decision when it comes to this. When you get the handout that talks about your options at the bottom and it says, enrolling in Medicare, you have the choice to stay on original, purchase a supplement, a drug plan, or choose an advantage. I would say if you're new to Medicare, you should be able to make a pros and cons list to both of those options and be able to say, okay, here's the good and here's the bad of each of them. And by the time you're done gathering the information that you're looking for, you should be able to make an informed decision as to, which one works for you at this time. And then, of course, enroll. You always want to enroll when it's time to enroll or delay if you're not ready. And then a yearly review. It's always smart to do a yearly review, especially during the annual enrollment period, because anyone who's on Medicare during the annual enrollment period, even if they're on original Medicare and they have a supplement, the drug plan, they need to look at the drug plan. Should they switch the drug plan? Same thing with the Advantage plans. You always want to have a yearly review when it comes to those options. And then, of course, if you guys have any questions, feel free to ask them right now. Like I said, you could ask them throughout, but
So first, let me see if I can find my reaction button. But round of applause to Ms. Jennifer for leading us in this educational experience. As I do have one final for those who are still with us. I do have one final question, pop quiz. Hopefully everyone gets 100% correction on this answer. So if you're looking at the screen, how long is your initial enrollment period to enroll in Medicare? I already see somebody answer that. So just if you can, feel free to submit your answer to that question. Again, how long is your initial enrollment period? And in closing, as we go through, one, I want to, again, thank our participants for joining us this evening. I know this was more on the longer end, but I don't think it was lacking any quality of experience, any quality of education, because Medicare has so many parts, has so many nuances, and even I still have a lot of questions to ask. So first, thank you for joining us this evening and sticking with us to this point. As we conclude the poll question, I will open the floor for any other questions that you may have. And if you do have to leave us this evening, I thank you again for joining, and thank you, Ms. Jennifer, for again guiding us in this educational experience. Ms. Jennifer, if you don't mind, I do have a few questions that I want to ask that I think will be helpful, because oftentimes when we open the floor for questions, some people don't know what questions to ask. And there are some things that you mentioned throughout our presentation that even I would love to know. So if you don't mind sticking around for just a few minutes, I have like 3 questions that I want to ask. So to end the poll and share the results, the correct answer for our final question this evening, how long is your initial enrollment period? It is indeed 7 months. So first, I would say for anybody that is 63 years old and approaching 65, I do feel bad for you, not because you're looking forward to retirement, but because I know how many solicitation calls I get about cars extended warranties. I could only imagine how many phone calls, text messages, and emails that you get, not just for that, but for Medicare and supplemental plans. So, hopefully you are using discretion on what things you're answering, what things you're responding to, what things you're clicking in your email. 2, as you're approaching your 65th birthday, you have 3 months prior to that birthday, the month in which you turn 65, and then 3 months following to enroll in Part B for Medicare. And as well, the month you turn 65 and 6 months following is when you can have a Medicare supplemental plan. We'll again thank everyone for their participation. If you are able to stick around, we do have a few other questions that we're going to get her to answer. So thank you, thank you, thank you, thank you. One question that was asked, Ms. Jennifer, do you mind sharing your contact information? One of those PDF slides, maybe towards the end, may have your contact information. Do you mind sharing that on the screen one more time?
Yeah, let me put that up. Hold on. Let's see. Let's do share. Put that back up. Let's go over here. Hit share. Okay. All right. Okay. There we go. So if you want to email me, if you have
All right.
specific questions, if you want to call me or text me or email me, feel free. I know that in this kind of presentation, we don't get into anything plan specific or details, but if you have plan specific questions or you just want more clarification or you have a unique situation that you want to kind of talk through, that's what I do. So feel free to reach out.
All right. And I'm just